Welcome to my podcast. Today I'm going to talk about another challenging case. So after you introduce yourself and double check the patient date of name and date of birth, it happens sometimes that we deal with some sort of challenging patient who can be aggressive, violent, bullying, which can be unpleasant and mentally distressing. And it has been said in a survey last year that it showed like 13.7%, which means like 1 in 7 of the NSH staff member who had experienced at least physical violence in the last 12 months survey. Which includes bullying, abuse, harassment from patient or service user. And such behavior, as we all know, is not tolerated, unbearable, but there are certain ways to adopt and manage a difficult case scenario with certain patients. So ideally, it's best to avoid always such situation from triggering and try to break it down into a combination of contributing factors that you might know of, like, for instance, personality trait, and if there is any like intense mental distress that you know of certain patient, along, of course, attitude, behaviors, and the physical setting where you've seen those kind of patients. So it's always advisable and essential and wiseful to diffuse those kind of angry patient and maintain always a high standard of clinical situation and conduct during the whole situation. So, for instance, I'm going to just summarize some steps that I read off, which could be helpful in one way or another. So it says, like, you need to anticipate of those kind of situation, which could arise especially from previous conduct or previous incident or previous episode of some patient. So you need to, like, spot those kind of changes in the mood, whereby could lead unintentionally or intentionally to certain situation of aggressiveness and violence. And this situation, risky patient should be anticipated and dealt with. Like, for instance, Saturday night, if you are in a shift in A&E, or if patient been waiting for quite a long time, this could trigger certain situation, or in case you are delivering a bad news, or if patient is not feeling well, distressed and irritable and well, or maybe alcoholic, or patient might have signs like patient in constant pain, or fear, anxious, or distressed by certain health situation, or patients taking certain drugs or have history of substance misuse. All of that could turn patient or people to violence, and especially if you're dealing something that, or if you are delivering something to the patient which won't be happy to hear from you. So you need to tackle situation in a professional way and with element of sympathy and empathy in order to diffuse the situation and not to escalate it, and God forbid it might go into something nasty. So it's always wiseful, as I say, to diffuse situation by trying to avoid it and keep patient calm by asking open questions and actively listening to what's being said, and don't assume anything or write something wrongly, and work for the best interest of patient. So, for instance, I'm going to give you an example about my situation. As you might know, I hinted about what had been true, that e-bike struck into my back while I was walking on the pavement. This, of course, in the daytime, of course, happened, and it just caused me a lot of troubles. I'm struggling with now, and it's obviously like a life change things. And it distresses me sometimes to know when I get the letter that GP or the doctor or whatever, right, for instance, I had a fall and I fractured my nose, which didn't happen like that. Someone pushed me and caused me multiple fracture, multiple injury that I sustained. And also in another letter, to be told that I was hit by a car or your RTA All of that just distressed me because I wasn't even in the road at all, and I know how to cross in the road in the UK, and I know where to look. And I was merely in the pavement in the daytime. It was sunny. It was December, and I was right across to the wall. So there's a big space. There's a space around me where the stupid e-bike rider can avoid me, but he didn't. He just flashing me, crashing, and caused me just troubles, and he fled the scene. And all of that just distressed me. However, I compose myself. I don't let myself abuse my colleague or shout or any of that, because I know nothing can be undone. And I just try just to explain. I'm in constant pain, by the way, from the whole injury, and from just imagine yourself in constant pain, how would you feel? So just I withdraw. I just seclude myself in my home. I don't go out too much. I just do what I can do, and apart from that, stay in my home because I don't want to moan about the pain. There's nothing can be done. And those pills they just give me, they don't help, just cause me drowsy. So I'm just trying to compare to my situation, and of course, everyone's response is kind of different, so you can't, of course, compare. So the best thing always to avoid confrontation. I always, in my nature, avoid confrontation with whatever. Even my neighbor, they were horrible to me. I just avoid confrontation. And so it's the best thing to adopt is avoid confrontation by the patient for the patient by wronging them or saying that you're wrong, because you just imagine if you say to someone, "Oh, you are wrong," you don't know how they're gonna react. Some people they might accept and say, "Okay, I appreciate what you said. Can you tell me why?" And some of them are just crush things on your face. You don't want to put yourself in that kind of situation. So it's best always to respect their views and their wishes, even if there's medication or if they ask it for a second opinion or I wish a different treatment. So for instance, I remember the first ENT who saw me, who didn't tell me what to expect and what to not expect, and he was really harsh. And when I requested a second opinion because the operation did not take place as it should be, he just dismissed me harshly without explanation or being thoughtfulness or understanding to the situation. I'm being true, I'm being put to. So all of those things can be nasty. So maybe if someone else been dismissed that way, they might, call them and maybe shout on them or any of that. I haven't done any of that. Just adopted that there's nothing to be done. I just need to be patient, and that's it. So it's been wise as well to listen to your patient attentively, because they're the patient who knows themselves quite well. And also don't delay their treatment, even if you are in a position of power, because this can be cruel. And also try to use emotional regulation to control verbal and nonverbal expression of anxiety or frustration, like, for instance, the way how you talk to your patient, the eye contact, nobody butchers. All of that can aggravate situation or calm it down. So we need to decline or listen the emotional arousal and the agitation and become calm. And if your patient, say for instance, show up with a weapon or anything unexpected, just tell them to put it down and rather than passing it over. And also, if you are suspecting a patient to be violent or there is an incident before, try to see the patient in a wide space. Maybe you have like a rescue button that you need to press to seek help if it's something like, off. I read once an article here in GGB surgery. One of the patients threatened their doctor that they're gonna make them feel sorry. And I read also someone attacked the surgery and destroyed the window and stuff like that. So this is kind of situation which we don't want to go through, and can be intimidating, can be scary, because sometimes they might be overreacting and maybe jeopardizing, so we don't want that to happen. And always seek your colleague and seek your manager or employer to ask what should you do in such kind of situation, and take your time when things goes very bad, because even doctors, they're human beings, might need time to be treated or to have time out if they have like a physical assault, and they need to reflect once the negative situation or the negative experience is over, as the decision can be made or concluded in the heat of moment. And the other thing you can resort to is ending the relationship with the patient if they are really violent, abusive, bully, made threat to you, or displayed criminal behavior, or acted in a sexual way, or persistently acting unreasonably, and write down to the patient explaining why would you do so after contacting a colleague or your employer to seek advice what should be done in this situation. And if the situation involved with police, for instance, you need to apply for a special allocation scheme whereby you will remove your patient from the list of that surgery. And with that, so the patient will need to appeal and wait being allocated and assigned to the other choice without being chosen their own care for at least 12 months. And when I'm referring to for instance, there's an issue, for instance, like if the patient, for instance, acted unreasonably or maybe acted in a sexual way. Nowadays, we can hear a lot of male doctors act unprofessionally and being complained about, so have to be always chaperoned in order to avoid anything that might cause a problem in the future, because we know that doctors cares a lot about their reputation. And as a professional conduct, no one wants to be given the name of being impaired or had privilege or superior power to conduct on their patient or a colleague or whatever, because this is ethically unacceptable. So we need to be very wiseful and thinking ahead in a professional way, and never to abuse our situation in whatever ways. Another story I read about a doctor who gave a cosmetic injection to a patient, trading for, of course, sexual conduct, which of course is not a nice thing at all, just degrading and damaging to that doctor's reputation, because those kind of conduct is unacceptable and shouldn't happen at the first place. So by that, I hope I summon what can you do when you deal with kind of situation which can be aggressive or violent. Always try to diffuse the situation, try to calm it down, ask the patient, why is that, what's the reason, and if there's a reason, if there's a need for apologizing, of course you need to apologize for the long wait or whatever, and just take those steps I just mentioned, stepwise, and act from there. Thank you.